to CHS. We're excited to be here to join you in this auspicious occasion, this wonderful conference, and it's my pleasure to bring an introduction to CHS. We're really a local Kenyan organization, and that's what we're really proud of, utilizing Kenyan knowledge, Kenyan experience, Kenyan expertise to provide solutions that are responsive to the needs of the populations, to the communities that we serve. Our mandate as an organization is a public health response to respond to existing and emerging public health needs, and we have been able to respond to particularly the HIV burden in the country, and as well as TB. Our relationship with the Siaya County began way back in 2013 when we started implementing the TB program funded by USAID, and has grown since then to 2016, where we started the HIV response late in the year 2016 within Siaya County.
This is a 5-year project, started in October 2016, and basically supporting 119 facilities in the 6 sub-counties in Siaya County. We are supporting the county in HIV prevention, care and treatment, and VMMC.
The Shinda project really aims in terms of achieving epidemic control through the UNAIDS targets of 90-90-90. So we have to identify people living with HIV, put them on treatment, and ensure that they achieve viral suppression. Through the first 90, we've been able to ensure that we set up systems and processes to ensure that clients coming to the facility are tested, and those who are positive have been able to be put on treatment. So testing will involve ensuring that each and every service delivery point, a client is able to be screened for HIV. Those ones who are eligible receive the HIV test. This involves both patient and non-patient. Looking at other areas of testing, the program also become innovative strategies, such as partner notification services, whereby clients who are testing positive, the counselors are able to elicit and follow up their sexual contacts, who once they have been able to be reached, they're able to be tested, and those ones who are positive are linked into care. Looking at the second 90, I think we're able to ensure that all these positive clients are put on treatment. And once they are put on treatment, quality care is given to them in terms of provision, in terms of regular follow-up at the clinics, and also giving them the proper testing to be able to monitor their outcomes, such as CD4 and even viral load. And any opportunistic infections are identified early and treated. So in line with this, also looking at the last 90, the program has really ensured that from this point, those clients who are on care, once they receive the viral test with the interventions that have been given, really they're supposed to achieve viral suppression, touching on the last 90. But by them achieving the viral suppression, the chances of transmission of HIV would be much lower, and the quality of life would be able to improve, and even chances of actually getting treatment failure would actually be reduced.
The other key intervention again is VMMC, where so far for the 2 years we've implemented here, we've offered VMMC services to about 90,000 people, and we know the role that VMMC plays in HIV prevention.
VMMC has a big contribution to epidemic control. We are aware about 15 to 20 circumcisions are able to avert one. They are able to avert one case of HIV. What has been interesting is in the CHS programming is that we are doing a hybrid system. What I mean by hybrid system, we have a component of MOH role. Most of our staffs are MOH, and just the team leaders are of CHS. That means we are trying to bring in the sustainability angle to the program.
So apart from the Shinda project, CHS has also partnered with the County Department of Health to implement a more specific TB intervention, Finding the Children, funded by TB Reach, that we've christened Fikia. We would like to reach the children, and this has been a project that has been implemented in Siaya County over the last now 16 months or so, and focused on diagnosis of TB among children. We know that that's a big challenge at getting samples from the children, and we have had certain interventions to to support this within the health facilities. Siaya was one of the intervention counties among 8 others, and in these intervention counties, what we are seeing from the data is actually significant additional cases, what we call additionality, and we're really proud of the work that has happened within Siaya County to support diagnosis of children with TB. In addition, we have a recent project funded by the Children's Investment Foundation Fund focused on adolescents and adolescent adherence, really layering additional interventions, technology solutions to the famous OTZ clubs, Operation 000 clubs, to enhance adherence among adolescents, to really push the envelope to get to the 90 and 95. That's our target.
There are many challenges that the adolescents face. There's stigma, there's all that, especially in the schools. But basically, whenever we enroll the adolescents into an OTZ club, you know, they get there and they realize that they're not the only people, that they're not the only ones living with HIV. So that sense of togetherness, it gets them going. What we do as the OTZ champions, of course I'm not the only one, we are a team. We empower these young people to take charge of their own health, and you know, we teach them that it's not the end of life. You have to keep going. No matter what hurdles you meet, you have to keep going. CHS has taken me through a number of trainings. Through these trainings, I get the information that I'm able to disseminate to the young people.
Going deeper into what we do, we're currently supporting about 1,000 service providers. Of course, we also want to capacity build these service providers to offer quality HIV services. We are also equipping them just to make them comfortable in their work. So tools, job aids, and other actually items to make them offer quality services.
Apart from the human resource support, they also supported in infrastructural development, which is done to most of our facilities that offer care and treatment. And within that, then they've also given us some equipments that are used within those particular centers, together with also supporting our county health management team, ensure that there's care coordination within the level of county health management teams. CHS is a good partner, and of course we still look forward to working with them to be able to reduce the prevalence of HIV and AIDS, which stands as 24.8% currently at the county, to a lower level that is manageable. But for those who, of course, we've identified, we initiate them on care and treatment through the support and help of CHS and other partners, and this is very key for us as a county in the fight against HIV and AIDS.
The burden of HIV is still high. A lot of work still needs to be done, and the project is really committed through the various team members that we're able to be in line and be able to achieve this by the end of this particular project.
The work we do in Siaya is a manifestation of the reason why CHS exists. CHS exists for the communities. CHS exists for the children, for their parents, who are our brothers and sisters, who are in communities who require quality health services, and in this case HIV services and TB services as well. And that's really why we do what we do. That's why we are open to collaborate and to do all that we can to ensure that quality care is provided and that the health outcomes and the ambitious goals and targets that we have for our country and globally are achieved.